Welcome back to a special Cancer Buzz series on delivering quality cancer care during the COVID-19 pandemic. Today, we take a virtual trip to Montana and learn how rural cancer care providers are managing with limited resources. Dr. Chad Pedersen is a medical oncologist at the Sidney Health Center in Sidney, Montana.
We're about as far away as you can be from the hotspots in the United States, just this lone outpost on the northern plains. But it's been very real for us, even though we haven't had that many cases. And there was a study published recently that areas like this perhaps will be, in the end, the hardest hit because we have an elderly population, lack of access to medical care, and only so many medical providers, and can be easily overwhelmed. And that's why we've tried to brace ourselves like we have. There's not a lot of excess capacity. If we had a little epidemic here, it would be devastating, and it's not clear how we would manage a little epidemic. So we've been on guard, and that's presented its own challenges.
How well was Sidney prepared, do you think, at the beginning of the pandemic or the crisis? And how do you think that you're doing now?
We weren't prepared at all. I remember the first day we went on lockdown, which was March 16th, Monday, March 16th. And I said, what are we going to do for testing? And I was told, we're not going to be testing. And then we had meetings about PPE, and PAPRs came up, and the question was, what's a PAPR? So yeah, we really weren't prepared at all. We got 150 tests 6 weeks ago, and that's all we got. So we haven't had very many positives in this part of the country, but we also haven't tested.
Have you had to use any of those tests?
So we've done some tests. So we still have our 150, but we've used about half of those. And we've had a few positives in the county. And that was pretty exciting when it happened. Of course, we've been on guard from the very beginning. And, it's just such an isolated place. And we're a long ways away from another medical facility, bigger medical facility, and like 4 hours away from a bigger medical facility. And they told us, if you've got cases, you're going to have to take care of them there. So we've done our best to brace ourselves. So when we had a few of these positive cases, it caused quite a commotion, but we still have not had a positive case in the hospital. So, I don't know how many places around the country that can say that, but we have not had a single positive case. We've done some testing. We only have so many tests that we could use, but none of them have been positive in the hospital.
How has access to PPE been? Is that an issue for you? Are you able to utilize what you need, or how's it going?
It's tough. It's tough everywhere. We weren't prepared, like most places, for the PPE crisis. And by, the time we wanted to get more PPE, we just couldn't. And we were supposed to get a delivery from the state, and we weren't told what we were going to get, just that we were going to get a delivery. And at my update meeting last week, we still had not gotten the delivery from the state. So we're getting by. We're reusing masks. The local ladies have gone to work. They have made a tremendous number of cloth masks, and we're so grateful. We have such a wonderful community that they really went to work making cloth masks. So that's helped. We're finding ways to get by, but yeah, PPE is in short supply. And because we can't do testing easily, we burn up PPE waiting. For instance, if a patient's in the hospital, waiting for them to test negative. And so, yeah, challenges for PPE, just like everywhere else.
How has your patient care changed?
We've really embraced telehealth, telemedicine. And it's been such a huge boon for us. I have patients that will travel 2 hours in one direction, sometimes over bad roads, and, it's still been winter for us up here. We've really embraced telemedicine. So now I'm seeing most patients by telemedicine, and they love it. And it's been a great way for us to keep patients at home, keep them in their communities, and limit exposures to them and the staff. And one of the considerations I had to make was, what's the continuity of this clinic? If I'm down for the count, there's not another oncologist that can step in. We're not part of a larger organization. I mean, this is a big practice that could not be easily absorbed elsewhere, let alone the distances. And so how do we maintain continuity of the clinic? So part of that was embracing telemedicine, and it's been a huge boon. There's been some agonizing decisions about treatment and starting treatment, delaying started treatment. It's always tough. Someone's newly diagnosed with cancer, and to talk about perhaps delaying their cancer surgery or whatnot. But we follow the American College of Surgeons guidelines about cancer surgeries.
I wonder, do you think that this perhaps could be the turning point for telemedicine in rural communities? We're finally having to get patients on board with it and get providers on board with it. What do you think about that?
I hope so. It's been very successful here. Patients love it. And there's been some real illustrative moments that I've had with telemedicine. One thing I've learned is it's different than a phone call. And like they say, so much of communication is nonverbal. And being able to see a patient conveys a lot that you don't get over the phone. We've also been able to have family conferences. So patients have been isolated, their families have been isolated, but we've been able to get everyone online all at the same time. They're seeing their loved one, I'm seeing them, I'm seeing the family, and it's like one big virtual family conference. And that has been so valuable, not only for me, but for the patient and for their family. I didn't have the opportunity to connect with family like that before. Yes, you could have a speakerphone call or whatnot, but it wasn't the same. And so this has been a huge boon. It's been very successful for us, and especially for my very rural population of patients. They have really embraced it and saves them what is a long drive just to come to the cancer center.
You can find more tips and resources at the ACCC COVID-19 Resource Center, and you can find a link to that in the show notes. Next week on Cancer Buzz, we check in with a New York City-based oncologist to learn about his experience. Until then, for the Cancer Buzz team, I'm Summer Johnson. Stay well.